Continue our coverage now on the coronavirus outbreak. Staying home from work and school and the stores has been challenging for just about everyone these last few weeks. But state leaders say it is making a difference here in Connecticut.
Channel 3's Caitlin Francis joins us now with a look at some of the good news about the numbers. Kate?
Yeah, isn't that nice to hear? Just a little bit of good news in all of this. But first, I want to talk about some of those numbers. 7,781 people in the state have confirmed cases of coronavirus. I'll elaborate more on that in just a second, but I want to get to that little bit of good news. Governor Ned Lamont says we actually seem to be flattening out. 277 people in Connecticut have died due to the virus. More than 1,300 people remain in the hospital. Over the last several days, the average intake in those hospitals has been about 90 patients per day. But here is that little bit of good news. Before that, those hospitals were averaging 102 patients a day. So those hospitalizations and deaths actually seem to have slowed down just slightly. Here's a little bit of more good news. For healthcare centers, the state secured an extra 400 ventilators, bringing the statewide total to 1,400. Connecticut is estimated to need about 4,000 of those ventilators when the virus peaks.
Means that peak may be somewhat mitigated, only thanks to your strict social distancing. We're going to focus like a laser beam on making sure as we move beyond this COVID crisis, we do it in a thoughtful, safe way. And that means starting with social distancing, hey, dude, keep your distance.
Yep, keep your distance. And while this is some encouraging news, we are not in the clear just yet. At this time, the state will still keep those social distancing guidelines in place through April. Our east, the governor of Rhode Island has extended executive orders meant to keep residents home until May 8th. Caitlin Francis, Channel 3 Eyewitness News.